go ahead and get started. Welcome, everyone. Good afternoon, and thank you for joining us, the Superior Health Quality Alliance Nursing Home Leadership Roundtable. This is one of our special events, our kickoff call. Superior Health Quality Alliance has partnered with Viven Health to present a interactive combined vaccination program that we are kicking off today. My name is Constance Tetrov, and I am a Quality Improvement Advisor with Superior Health Quality Alliance. And I am accompanied by a few of my colleagues, Keisha Plesko, Tabitha Meyer, Margaret D'Oliviade. I said that wrong. D'Oliviade, as well as our guest speaker, Natasha Dickinson. Superior Health Quality Alliance has partnered with Viven Health, a nurse-led behavior change company, to provide an innovative virtual learning program to complement our current infection prevention practices. We host these 1-hour sessions on the second and the fourth Wednesday of the month. The first half is a didactic presentation. Then the remaining time will be used for Q&A. We also will have a live demonstration of these interactive modules presented by Natasha Dickinson. The PowerPoint presentation link will be dropped into the chat momentarily, as well as other things throughout the presentation, such as flyers and information that we will be presenting on. Please use the chat box to share any comments, questions, and even resources during the presentation. Besides learning from our speakers, we also learn from each other and our peers. Towards the end of today's event, we will also put an event evaluation link in the chat that will only take you a few minutes to complete. We use your evaluations to help us give you a better experience. Today, we have Miss Natasha Dickinson. She is a doctorate prepared nurse practitioner who specializes in public health. She has been in the nursing field for almost 15 years, working in medical surgical areas, oncology, care management, travel nursing, and senior care. As a FNP, her primary work has been with the geriatric population, focusing on health promotion and disease prevention. Ms. Natasha is the Director of Clinical Affairs at Viven Health. Her primary role is acting as a liaison and an implementation specialist between Viven Health and participating organizations, as well as leading all community initiatives. Please help me in welcoming Natasha Dickinson, and we look forward to sharing your profound experience with us today. The floor is all yours, Ms. Natasha.
All right. Thank you, Constance, and thank you all for taking the time out to listen to our unique education platform. I'm very excited to be here, and I'm excited to get you all started with everything. All right. Next slide, please. All right, so as Constance mentioned, I am part of Viven Health. We are a nurse-led, nurse-founded education company. Our belief is when you change a person's behavior, you can really change a life. Okay, next slide. So the objectives for today are pretty simple. First, I just wanted to introduce to you all Viven Health and our interactive platform. I want to provide an overview of what our vaccination program can provide for you. This is a free program, and how it's easy it is to implement in your facilities. Next slide, please. So our education is different from your traditional education. So as Constance mentioned, my background is nursing. I've been through 1,000,001 different in-services where I sit there, I watch a video, or I sit there and I read something very boring. Our education is different because it focuses on interactivity. Research has shown that by doing this, it helps with behavior modification and a person maintaining that behavior change. With our education, we not only provide education on vaccinations, we also can provide education on infection prevention, disease prevention, and even chronic disease management. We're currently in over 10 states, and we are continuing to grow. Next slide, please. So the beauty of our program, it can be accessed on any smartphone. It can be accessed on any tablet or any computer. So with that being said, a person can complete our program anywhere, anytime, any place, as long as they have a QR code. This is different from traditional learning as well, where you have to be locked in on a certain computer or a certain education platform. With ours, everything is available to you just with your phone. So it's kind of like you have access to education at your fingertips. We are able to provide weekly reports on individuals who do complete the program, and that gets sent to the facility leaders, such as the DON or the administrator, and through an email every week. As mentioned before, this type of education is not only unique, but it is scientifically proven to be more effective than your traditional learning. And as mentioned, this does not just give people the education, it helps actually maintain that behavior. And whenever you're trying to educate somebody, you know, you can give education all day long, but what really matters is that they do something with the education. Okay, next slide, please. So if it's okay with you all, I will just I'll show you all how this education program works. We will be doing a combined vaccine program for all the Superior Health Quality Alliance nursing homes. So this program will cover the vaccinations of RSV, pneumonia, COVID, and influenza. Okay, next slide, please. So as mentioned, this program is free to you. Superior has provided this program to all the facilities. Not only is a program for your staff members, it also is going to help educate your residents and the family members. And it's available in multiple language. And the beauty of it is it takes less than 10 minutes to complete. Now, in our one of our pilot programs, individuals who completed the pneumonia pilot, whenever they took the program, 92% of individuals learned how to prevent pneumonia. Another 72% of individuals who took our program actually received the vaccine who needed it after that. So it just goes to show that this type of education is not only educating about the importance of the vaccinations, it's helping people change their mind and actually get vaccinated. Okay, next slide, please. I think I mentioned this already. So it increases vaccination rates and awareness. It allows for healthier residents, engages family members, and just basically promotes healthy living. And this is a turnkey implementation plan. So it doesn't require any work on your end. Literally with that QR code, if somebody scans it, they're able to access the program and complete the program right then and there. And we do, like I said, strive to have family members complete the program, have residents complete the program. And that's because at the end of the day, we want a healthy environment for all that live there, for all that work there. And it does take a village in order to have a healthy environment. So that's what our goal is to keep everybody healthy with infection prevention and increase those vaccination rates. Okay, next slide, please. Okay, so it's okay with you. I'm going to go ahead and share my screen. And me and sharing screens have a love-hate relationship. So if at any time you can't see my screen, just let me know. Okay, can you see the screen?
No.
Oh, nope, not yet. It's still loading.
Now we can.
Okay, perfect. Okay. So with our education, we focus on providing bite-sized information of a comprehensive form. So for instance, instead of giving a whole lot of content about pneumonia or COVID vaccine, we like doing it in bite-sized segments. That way people are able to kind of digest it better and help them understand it more. So we give topic areas of various interests. So how can you get the viruses? Who should get vaccines? Do the vaccines actually keep me safe? We even touch on RSV in children because that's something that affects residents, you know, family members and employees as well. But we go a step forward by not just providing the information, we make it fun. And that's what sets us apart of everybody else. Now, we try to keep the wording to a minimum of any education that we provide. all wording is at a 4th grade reading level to help with that. And we just give education, like I said, that is fun. So nothing that we provide is rocket science. It's not information that people have to go find out. It's things that people already know. We're just presenting it in a different way. So this, for instance, is a module that shows the importance of getting boosted and getting vaccinated, how germs, they change over time. So this is interactive. So this is not a video. This is actually me clicking on the screen to do something. So it just kind of shows how germs mutate. It's in a fun, interactive way to demonstrate, how germs are mutating. You can continue. So it tries to give an emotional response with things that we do educate about by showing the hospital room, or another option, if you do get boosted, how you can have a happy life. So we try to appease the people that way, just by showing that emotional response as well. Okay. We try to do general questions. For instance, which do you think is the most dangerous germ? Cold, flu, COVID, RSV, pneumonia. So we'll just say cold. So that's not the right answer. Flu, that's not the right answer. COVID. And it does show individuals the right answer over here with the check mark. And finally, the pneumonia bacteria. So like I said, it's just educating in an interactive way. So instead of just saying the pneumonia bacteria is most dangerous, a person has to go through interactive interactions to get that answer. Okay. And like I said, we try to keep that wording to a minimum. And we don't try to persuade people to get the vaccine. What we try to do is just provide evidence-based information. Based on that information, we hope that people will want to make the right decision and get vaccinated. Okay, I'm going to show you another example of our interactivity. Okay, this is kind of showing how the germs enter your body. Okay, now we try to keep videos to a very bare minimum. And that's just because, as I said before, we really don't learn a whole lot through watching videos. We learn more through doing. So I'm going to show these short videos. I think they're under 20 seconds. Okay, and then it shows also how it is if you're vaccinated, what happens to those germs. You are likely significant side effects. You also missing the chances you will spread the virus. Okay. So as you've seen there, like I said, it just kind of makes it fun. So instead of just giving that information, we make it into an interactive and fun way. Okay. So this is another example of showing somebody how risk factors affect you with different viruses or pneumonia. So for instance, a risk factor of being over 65 years old. You simply drag that to the nasopharyngeal area, and that just shows that the germs become awake. So you have a higher risk for developing complications. If you have lung disease, what happens? These germs become awake again, showing that high susceptibility again. If you have heart disease, same thing. And like I said, this is not brand new information. We all know this, but we're kind of hitting people in a different area with information to kind of make it hit home more. But what happens if if you have those different comorbidities? As I said, it increases your chances of being hospitalized. Okay, but what happens if you have a pneumonia vaccine or a COVID vaccine? Those germs are able to be eliminated and you are safer. Other ways to help protect yourself, maybe like hand washing. So you drag that over and it's going to kind of create a shield around those germs to help safeguard you. And same with cleaning surfaces. It helps safeguard you. Okay. Now, anything that you've seen with my demonstration, as I mentioned, besides the 20-second videos, everything else has been me actually moving my screen and doing things. We try to capture different types of learning mechanisms because the truth of it is everybody learns differently. So we want to try to catch everybody in different ways. So another example, what conditions can make it more dangerous to get sick? This is a learning concept called discovery learning. So if someone knew nothing about what makes it more dangerous to get sick, they can kind of explore with this or discovery learn. If they would click the wrong item, it's going to bounce it back and force them to create the right option. So this is another way to help with that behavior change and behavior modification. Okay. So I'm going to stop my demonstration because you all have access to all of this, and I will show you all how easy it is to implement now. All right, Constance. Okay, perfect. Thank you. And then next slide, please. Okay, so the program's easy to use. You all saw how easy it is to use, just as easy to implement as well. So we have made this very easy for you all. We have created flyers for you with the QR code. It's already available for you. We will be sending, well, Superior will be sending that QR code and that flyer with you via email. Okay, next slide. Next, you're just have to distribute the flyer. So this can be done in a variety of different ways. Okay, next slide. So anyone can literally distribute the program. It can be a marketing person, it can be activities director, it can be the DON, the administrator. All you have to do is just get that QR code into the participant's hand. That's it. So what we have did in the past with successful facilities is they hold an in-service to help educate the staff about the program. They can have the staff scan the QR code, go through it, learn about it. And then also with this, we really want to educate the residents and the family members. We want to keep them safe. So a great way to do this is even having a resident in service where the activities director gets involved. You can have all the residents gather in an area, go through the program, and this kind of helps build rapport, and it's something fun and different for the residents to do. The distribution options literally are limitless. Whatever you want to do, however you see it happening, you can make it work. Okay, next slide, please. So as I mentioned, next step is just the user just scans that QR code, they register, they complete the program. That's it. This can all be done, like I said, on your cell phone. It can be done on a tablet. If you don't have a cell phone or tablet, we also provide you with a website link, which you can just click on it and also access it that way as well. Okay. Next slide, please. So if you all want to see how easy it is, if you all could get out a cell phone, if you have it handy, you can just go ahead and scan that QR code and you can get registered now. And everybody who does participate in it does have to register. So for instance, if it is if you have 10 residents that are completing the program, they do all have to register in order for us to be able to track it, and they get a certificate at the end. Now to register, all you need is just your facility name or even your CCN number. Next slide, please, Constance. So just that simple. Now, I always like to mention that any personal information that you provide, such as your phone number, your email address, even your name, we do not use that for anything else. Viven Health doesn't, nor Superior. It's literally just for reporting. That's it. And at the end, as I mentioned, once you complete the program, you do get a certificate of completion. And that's just showing that the person has completed the program. Now, as far as the facility goes, by having individuals with these certificates, it kind of just shows that you all are proactive in infection prevention, that you all are taking that extra step to make sure that your residents and your staff members are healthy. And so for potential residents or for even family members, that kind of gives them a sense of comfort and ease, knowing that you all are taking those extra steps to keep their family members safe and healthy. Okay, next step, please. Okay, and then as I mentioned before, we do weekly reports. Those are usually sent out every Monday at 12 p.m. Central Time. Superior has been gracious to provide us with emails for the majority of everyone. So we try to make this little work for you. So basically, we will already be able to send you all that data once people start rolling out the program. Okay, next slide, please. And then that certificate of completion as well. You have an option to either print off the certificate, or it can be emailed to an individual or even into a facility leader. That is up to you all how you want to do that. Okay, next slide. So people might wonder, well, how do I get people interested in this? How do I get it going? I always like just to kind of provide a couple of tips for successful implementation. Currently, we are in over 2,000 nursing homes with our interactive education. So here's just some things that I've learned along the way. Okay, next slide, please. So first, it's good to kind of provide a time restraint. So for instance, if you just give a resident, a staff member, the program and say, hey, complete this, there's not a lot of urgency with it. So if you put a little bit of a time frame with it, so say, vaccine season is right now, we want to try to keep everybody safe. We're having a lot of infections right now, so we're trying to get everybody vaccinated. So if you could, in the month of March, complete this program so we can get everybody vaccinated. That kind of helps build that urgency to make people want to complete the program. And when I tell you that is important, it is important. Another thing you can say with the residents, on Wednesday's activity day, let's everybody complete this program. Or you can even give it to family members and say the exact same thing. We want to keep our residents safe during this season right now. Email the flyer to their family members. Another thing is you have to get the nursing home staff excited and on board as well. As I mentioned earlier, it takes a village to keep your facility healthy. So we need the environmental supervisor, we need the housekeeper, we need dietary, everybody to feel passionate about helping people get vaccinated. And this program is a simple, easy way to do it. Like I said, just with that QR code. Everybody has their cell phone connected to their hip, literally everyone. So that's not a reason for people not to have access to the program. They have it right there in their hand. And we also want to try to make it, part of their routine. We don't want this to look like extra work. As I mentioned before, we try to make this easy peasy for you. We try to do all of the hard work on the back end. So all you have to do is just pass that flyer out. That's it. Another type of thing that we do is you can also offer competitions. So for instance, say whatever facility gets the most amount of residents complete the program gets a treat. I don't know. In the past, we would send out cookies to high performing facilities that do really good. And that just kind of has that positive reinforcement, like I said, just to get people excited and to feel fulfilled that they did something. Okay, and then I've already mentioned that resident in service. Okay, next slide, please. So what's next? So be expecting an email from Superior with that QR code, with that link for you. You can print off that flyer with the QR code, educate your facility staff members about it, get them excited. It's a trickle effect. So it starts with you, the facility leaders, for you all to be excited. Your excitement is going to trickle down to the staff members, which will trickle down to the family members, which will trickle down to the residents. I know I keep saying this, but it takes a village. We all have to do our part to keep everyone safe and healthy. And all you do is just pass it out and get started. It's that simple. Okay, and then next slide. If you have any questions, I am here at any time. You can email me. You all can jot down my email if you'd like. You can jot down my phone number. I'm available by text, by email. You can call me. I'm here for you. So I'm really, really excited to get you all started. And I think we can make a huge impact in your facilities. So thank you again. I appreciate it.
Okay, so thank you so much. I think Natasha Dixon, that is an amazing program. I am really excited to be offering it here in partnership with you. We are excited and have been sending out emails. We have dropped the link to the flyers and the registration, as well as the fact sheet in our chat right now. And we have time for questions. We did have one comment asking about, curious if anybody had any data on this year's vaccine. They had an outbreak and they lost 3 residents, all of whom were vaccinated. So very sad. We're sorry for your loss. So just wondering if they had any experience or if it's an isolated issue or common throughout the Midwest. Elena got him some information and I apologize, Mikesha got him some information about contacting the county to see about whether or not it's something that they have seen or if it's isolated, as well as if there's a state, there can be state information as well. Elena suggested maybe we can look into having a future call to report out and on the immunizations as well. And one of the things that I was thinking of is, how do you get people to buy into it? What are some tips that other facilities have specifically used to get the buy-in from staff and residents?
So basically, it's just all about just that impact that they can make and the timeliness of it. Let's just be honest. You all have, thank you, first of all, for all the hard work that you do with all the nursing facilities. Like I said, I am a nurse as well, and it's a lot at times, but I appreciate all of your efforts. And with that being said, we just want to try to emphasize that this doesn't take a lot of time. It's short. It's different. And, we all do want to make an impact. Having these vaccinations not only protects the residents, but it's going to keep the staff members healthy, keep them at work. If somebody's out for the flu, they're not working. The residents don't have that, that they have the staff that they would have. So it's all kinds of different ways to just kind of, emphasize the importance of the program and vaccinations.
Yeah. Also, if you're looking for a mobile vaccination clinic, a free mobile vaccination clinic, please reach out. We have an email for the immunization team to receive an email. We'll drop that into the chat as well to ensure that you have vaccinations. We are working throughout Michigan, Minnesota, and Wisconsin to get people set up for free mobile vaccinations. We can identify ways that we can support you in addition to the Viven Health modules, mobile vaccination clinic, and other options as well, resources and whatnot. The immunization email is in the chat now, so don't forget about that. Let's see if we have any other questions in the chat.
I think that when we're talking about nursing home facilities and how did they educate their residents and educate their families, how has this helped facilities who are struggling with education with their residents and family when they're going through a survey process or something like that? Do you have any examples, or can you just allude to what that could look like during a survey process?
Mm-hmm. So, like I said, the beauty of it is once you complete the program, you get that certificate. So if you do have a state surveyor come in, you're able to easily show, hey, we have had X amount of residents complete the program. We've had X amount of staff members complete the program. And once again, it's just showing that you're being proactive with infection prevention. With the residents, from my experience, the best way to get them educated with the program is that resident in service. Have everyone gather in and it could be done multiple times. Have everyone gather in the activities room, go through the program all at once on a big screen. And if you do it that way, all you have to do is you can email me the contact people who participated. We can log them in manually. We just want people to get the education. That's it. We just want to make that impact. For the family members, a lot of facilities contact family members through email. Perfect way. It's a flyer. Just email the flyer to the family members. That way they are able to get the education. Because with family members, a lot of times they are the decision makers. So we have got to educate them, let them feel comfortable about making the decision, and an informed decision is at that. That's what's important. Does that help?
Yes, thank you.
Another way is for staff or residents is, there's an activities board. We could be posting the flyer with the QR codes there. Some residents are very tech savvy. I've had several that are very tech savvy. Otherwise, they might be asking, what is this? Posting that information, having it available, as well as, near the time clock or near where staff are taking their breaks, or they do their education. Another idea is bringing it to your stand up and bringing it to your huddles every morning and saying, hey, we've signed up for this. I've completed it. We really want you to do this in 60 days. We think it'll help our facility. Let's really work towards this and get them excited. We did have one more question. With having the program in over 2,000 nursing homes, have many staff members who have completed the program?
Oh, sorry. So it's a work in progress. So probably, I'd probably say a little bit around half.
Okay.
Around half. It's this is just something that is an extra resource for people. So it's not a, you do this and it's going to have an increase in vaccination rates. It's just an extra resource to put in the toolbox. So it's just kind of getting that encouragement. And like Constance said, it would go a long way if you said, I completed the program. That right there is everything. It shows that you are on board, you're excited. So you're able to get other people the same way.
Some of that is identifying who some of your, I'm not going to come up with the right term, but I call them the key players.
Mhm.
So that key nursing assistant, that key RN, that key person that everybody kind of goes to and gets advice from
Mhm.
and does the right things, get them to buy in so that they can also push, hey, I did it. It took me in 10 minutes to
Right,
complete this.
right.
So those big players in this are important. Um,
Exactly, exactly.
Other question, do you find that family members are willing to take the time to complete the program?
Yes, yes. So with our program, I think I mentioned earlier, 91 or 92% of people learned how to, this is with the pneumonia program, specifically for pneumonia, learn how to identify how to prevent pneumonia. We had similar results with family members. They were able to help keep their loved ones safe after doing the program. So there's definitely ways to encourage them. And I think the main way with that is just kind of hitting that emotional response with them, saying what can happen if they're not vaccinated. Because it can lead to hospitalization, it can lead to sepsis, it can lead to death if a resident gets pneumonia or COVID. We all know that. So just really trying to play on that emotional response. And it's the truth. So that's why we really want to encourage that vaccination.
Another way you could get some residents to do it is offering it during the time you're doing a new admission or readmission assessments. So, you notice that Susie is not vaccinated for her pneumonia or her COVID-19, you could offer it to her while they're going through the assessment. So they're asking about immunizations, they're asking all those questions to the resident about their preferences and their code status and whatnot. You could offer it at that time, as well as offering it when vaccinations are, you're pushing the vaccinations, or if you have a mobile vaccination clinic. Before the mobile vaccination clinic, if you contact us on it and we're offering it, offer the program, put it up and try and get facility or people in your facility to complete it during that time so they're prepared for what's coming up too.
Exactly, exactly. And Constance, I do want to just say, I think I said half of the individuals have taken the program. I don't know that exact number because I don't want to I don't want to give you any false information because
Yeah,
it's different combined programs. So they may,
sure.
yeah. So I just want to put that out there.
Well, it goes along with all of the things that we're going through every time we have one of these calls. Immunizations are a topic of concern throughout the nation, throughout
Mhm.
our region, all over. So it is a concerted effort with multiple platforms to do.
Exactly, exactly, exactly. It's just another tool in your toolbox. Um, Everybody learns differently. Everybody receives information differently. So, for some people, this might work great. Other people hearing it on, a webinar or reading about it. You just got to kind of provide the education in a multiple different ways. So I definitely believe that.
Okay. Um, what is your usual process for follow-up when like a facility signs up for the somebody signs up at it and they send over a report? What happens the next 30 days?
So they will continue getting reports every week, just showing who's completed the program, how far they've gotten into the program. And we just really encourage people to continue, even though you have that initial outreach. It's not a one-time thing and you're done. You have to continue. Because, although The flu season is kind of coming to an end. COVID's so important to educate about. Pneumonia's all year round. RSV is kind of coming to an end too, but it doesn't just stop at that first initial conversation. You have to continue educating about the importance of the program.
And we're working through a process on how to touch base on a weekly basis for the first 30 days from Superior Health for all of those facilities that do sign up and get their staff going on it, so that we can find ways to encourage them and find opportunities just to keep them motivated and give them some attaboys, I guess. So throughout for the first 30 days. So we are working through that process, and we are going to get that started right away.
Yes, positive reinforcement, very important.
I see that your email was dropped into the chat as well as the PDF again, all of the documents, as well as the immunization email. The event evaluation is there as well. Any last questions? Any things people can think of that they are struggling with? We learn from everyone in this, as well as our speakers. You can unmute, or you can put it in the chat. If you're having some kind of issue with immunizations, let us know. We still have about 16 more minutes, and so if you have anything, let us know. Do you guys offer other programs? What else does Viven work with organizations on?
So another big one we have, probably our most popular, is infection prevention.
Oh, nice.
That's another very important one. We also have diabetes, which is an amazing program, if I have to say so for myself. It's teaches about diabetes in a way I've never seen done before. Nice. And then sepsis is another program that we do offer for the nursing facilities.
Very nice. Another question I would have for the group is, what are you guys using for your immunization education? Are you, and you can drop it into the chat, you don't have to speak. What are you using for your immunization education? Are you using pamphlets, flyers? Do you have the IPC? Do they go out and educate all of the residents? Do you have, meetings for residents or staff about immunizations? How are you getting your people educated?
Great question.
This is the first program that I've seen that includes residents as well. So it's very interesting to me because, we don't really have a whole lot of interactive platforms for residents to learn. So really excited about that.
Right. And, the beauty of this program also is that tracking capability. So if you do just focus on flyers and everything, there's no way to quantify how many people have looked at that flyer. Right. With this, we're able to quantify X amount of people looked at this program, and we can really, be able to tell if it made an impact or not.
Yeah.
Another nice thing that might be helpful for people, because I know I was just talking with a long-term care facility yesterday that was kind of unaware of what it means to be up to date with the COVID-19 vaccination. So I think this could be helpful too, to just get an understanding of what you're reporting on that weekly basis. But essentially, for someone to be considered up to date with a COVID-19 vaccine as of today, they would have had to have gotten a COVID-19 vaccine since September 12th of 2023. So on September 11th of 2023, the new 2023-2024 COVID vaccine was released, which meant that as of September 12th, that was the only vaccine that anyone could walk into a pharmacy and get moving forward. So if someone has gotten a vaccine September 12th or later, they're considered up to date. If they haven't gotten a vaccine since then, that means that they are due for another vaccine to become up to date. So I know there's still a lot of confusion. It changes all of the time. I know that we've gone from having the bivalent booster, and at one point you needed to have the primary series and then the bivalent and then another. As of right now, in order to be up to date, it doesn't matter any vaccines that you've gotten in the past. All that matters is that you've gotten a vaccine since September 12th, 2023. So you never had to get a vaccine one time before that. You just have to get this 2023-2024 updated COVID-19 vaccine to be considered up to date. So if you're hearing that for the first time and thinking, oh, well, I probably have some staff and residents that could be due for that 2023-2024 updated COVID vaccine, that might be a great opportunity to put these videos out, these modules out, and then also to schedule a mobile vaccination clinic with our team. Those are free for both staff and residents. And we do have coverage across all 3 of our states, Michigan, Minnesota, and Wisconsin. So if you're interested in one of those, we could get you set up with one within the month.
That's awesome. Thanks, Elena. I agree. It's important for them to know exactly what, and all of us to know exactly what up to date means so that we can decrease the risk for infections for all residents. It is important considering that we might have moderately to severely compromised people in the nursing home to have buy-in to vaccinations in general. So COVID-19, the RSV, the pneumonia vaccination, those are all really important to prevent an outcome that could be poor for one of those high risk, medium risk patients that could be immunocompromised. I haven't seen any more questions, but all the information's in there. I did see that Elena got some information over to the person asking about Wayne, who asked about the vaccine, the flu vaccination with the loss of his residence. So that information is there for anybody to be able to see and click on the CDC link. I think we're going to wrap up our presentation if I don't see any more questions coming through. I appreciate that, Wendy. Thank you. Love the information we're presenting today as well. I just want to give you some more information about our next and upcoming presentation, which will happen on March 13th. We are going to be presenting on, we're going to continue our Turning Your Deficiencies into Efficiencies FTAG series with F884 reporting in NHSN, presented by Miss Elena Blair, who you just heard from. This is just in time for the upcoming planned annual healthcare personnel influenza vaccination data report, which is due, as a reminder, on May 15th, 2024. So we want to make sure we gave you enough time so you could reach out to us and contact us for NHSN help or technical assistance with that so that you guys can get those reports in. In addition, we want to make sure that you feel well prepared. Any of this information can be included when you reach out as well. Feel free to sign up, print the flyers, the fact sheets, all the things that were in the chat box and the links today, and get going with your staff, residents, families, and ancillary staff working on these amazing education modules. You can simply scan the QR code again and visit the link on the chat in the flyers. I apologize. In addition, we are starting to put in the topics in our e-blast that's going to be coming out, just to give you an idea of what topics are coming up, as well as be able to decide whether or not you can allocate the time. Maybe there's preferred topics that you really, really want to hear about. So we're going to put that in our e-blast information so that you guys will have that as well, and include the link to for you to forward on for this nursing roundtable. This concludes our session. Thank you again, Ms. Natasha. I appreciate all you have done for us, and we'll continue to work with you and our facilities to get this up and rolling. Before you exit, please click the link to the evaluation in the chat box. Sorry, chat box today. Once you have completed the evaluation, you will receive a link to download a certificate of completion. This is your only opportunity to complete that evaluation and receive that certificate. So please take a few minutes to complete it now. Thank you all for participating, and we look forward to seeing you on March 13th, 2024, 12 p.m. Central Standard Time and 1 p.m. Eastern Standard Time. for Miss Elena. Bye.